What can be done with saggy cheeks and jowls in late 20s? I'm 29 and I have saggy cheeks, jowls, and nasolabial lines. Is a facelift the only option for me since I've had permanent filler, Aquamid, in my mid-cheek area? It seems like it made my cheeks look even more saggy than before, and I have discoloration in the places where it was injected.
Thank you for your question. You're 29 years old and you state you're asking, is facelift a solution for you because of resultant jowling that occurred after having a permanent filler called Aquamid placed in your cheeks, which appear to have descended? You also state that you have some marks where the Aquamid was injected. So certainly I can give you my perspectives on this type of issue when it comes to permanent fillers and how to handle a situation like yours. A little bit of background: I'm a board-certified cosmetic surgeon, fellowship-trained oculofacial, plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. And certainly the challenges of so-called permanent fillers is something that I have dealt with to some degree of with a significant amount of experience at different levels, depending on the severity of the symptoms of a person who had this type of problem. So to begin with, this material of Aquamid is described as a polyacrylamide hydrogel, which basically is a soft tissue filler that appears to have certainly some advantages compared to other so-called permanent fillers, but I have always felt that soft tissue permanent fillers don't really have a role in what we do, because the face and the soft tissue changes over time. And I've had situations where a person who got this done, like yourself, at a relatively young age, had exactly the same type of problem that you did. And this was, for example, a man in his late 20s who got silicone type of injections done in another country, and it ended up going down to his jawline and or migrating and eventually descending, and I think the physical weight was a problem as well. I actually had to open up a flap of skin, like a facelift, to remove this material. This material became very rubbery and very hard, and it's almost impossible to take out everything. So as one thing to consider, maybe not now, but maybe in the future, is excision of this material. You know, as you get a little bit older, the facial volume will change, and you may want to just observe how things change with time. Now, so far, if it doesn't appear that you've had any inflammatory reaction or infection, then you can consider a different option. I would discourage you from a facelift. I think a facelift would technically lift the skin, but at 29, and even into your early 30s, I think it's still a little bit premature, and you may not have enough skin to work with in order to get enough of an impact on the lifting. Really, this is about a volume distribution more than it is about sagging and soft tissue stretching. So I think that one way to consider camouflaging your situation is a procedure like structural volumizing, which we do in our practice. And to understand that, basically what we're doing is we're placing volume of a filler that can be reversed in the hyaluronic acid family, such as a Juvederm Ultra Plus or Juvederm Voluma. And I would consider placing it along the cheekbones. By placing it along the cheekbones, it creates more of a natural kind of golden ratio balance of your face, so that you actually look better than if the face is more squared off and it appears to have like a jowl. Now, of course, it is camouflaging, but it might be a good patch for the time being, as you try to determine what to do as time goes on. If this material continues to descend and it cause other issues, then maybe a surgical option is worth considering. But if you've had this material in your skin for, let's say, longer than a year, then the options ultimately end up becoming surgical. And again, from my experience, and I've done this for patients who've come here from around the world who actually had material that the body formed incredible reaction to, and it's not the Aquamid, but a different material, and it created these large nodules. And in trying to remove these material, which was placed all over the face, this patient, for example, that I'm thinking about, I have to do multiple surgeries in order to get that material out in the maximum way to give this person a more natural appearance. It's very, very difficult, both technically and difficult for the patient to go through. So I would discourage you for moving forward in the future in not doing any more permanent fillers. In our practice, we basically use for the benefit of filling something that's reversible. So the hyaluronic acid family, whether it's the Restylane family or the Juvederm family, has a wide variety of different levels of thickness for the purpose of this explanation, so that you can solve a lot of issues without having to resort to something permanent. People always want something permanent naturally, but really our bodies are not permanent. Our faces change and things continue to evolve and shift. So I would again suggest considering doing a filler placement with a hyaluronic acid filler at the cheekbone level, and to kind of give yourself a little bit of balance. I would discourage you from any other procedures that try to use it, whether it's lasers or energy-based devices. I'm not sure that they're going to make as much of an impact for you. And I think that the goal is to try to give you some balance and minimize the amount of trouble you put yourself through or can get further into. So find a doctor who you'd be comfortable with doing this type of technique, where again structural volumizing is placing the material at the bone level, so that when you place it on the bone, the bone actually has a little bit of additional volume, but it doesn't sag the way this material did. Most of the time, fillers are placed in the soft tissue compartment, which is right under the skin. And beyond a certain level, they tend to flatten out or round out, and they end up looking soft, and your face looks kind of pillowy, which is something that a lot of people are familiar with. But rather, with structural volumizing, by placing at the bone level, we actually create structure and create this nice natural angularity. So I think that that's a technique that would be relevant and potentially worth pursuing. And the nice thing is, if you don't like it, it either goes away by itself and breaks down. It takes usually about a year. And if you don't like it and you really want to get rid of it, we can use an enzyme like hyaluronidase to dissolve it. So I hope that was helpful. I wish you the best of luck, and thank you for your question.